In the case study published by occupational therapist Lauren Frame, entitled Compression, Complementary, and Alternative Medicine, an Occupational Case Study, she reports the background, the treatment, and the results of a particular patient when treated using compression, complementary, and alternative medicine. So, according to Frame's patient, Mr. C, he suffered from a traumatic work injury where he was crushed by a crane and electrocuted. His injuries resulted in numerous medical complications, all of them mostly on the right side of his body, his right arm. He suffered from complications such as thoracic outlet syndrome, right ulnar neuropathy, carpal tunnel in his right hand, and lymphedema in his right hand as well. Lymphedema is the buildup of fluid in a particular area, and in his case, the right hand. He also had many other complications as well. Because of these medical problems, Mr. C now has difficulties performing everyday activities such as eating, writing, drying himself off with a towel, things of that nature. In addition to his limited mobility, he also has difficulties with swelling, stiffness, and numbness, along with many other symptoms, all in his right arm. Because he tried so many other treatment methods with little to no success, Mr. C proposed a trial run with alternative and complementary medicine to help improve his quality of life. After some discussion, Frame and Mr. C came to an agreement upon his treatment plan. His treatment plan was inspired partially by a book by Alfred Vogel called The Nature Doctor. So in this book, Vogel describes how cabbage leaf and clay can be used to alleviate swelling and bruising as well. The information found by Vogel, accompanied by the knowledge of Frame, helped to form Mr. C's treatment plan of clay mixed with a couple tablespoons of rainwater, for about 2 hours a day, from about 11 a.m. to 1 p.m. every day, followed by a mixture of cabbage that he put on his hand overnight to help drain some of that fluid out of his hand. After a couple weeks of this clay and lettuce or cabbage leaf combination, he was fitted for a compression garment that he was instructed to wear at all times except for when he was showering and swimming. In addition, there was also additional exercises and equipment put into place for him as well, all things to help him with his movement when it came to eating, writing, things like that. The results of his treatment plan were very significant. Mr. C experienced increased mobility in his fingers, his wrist, elbow, and shoulder of his right arm. He also had reduced pain. It was about a 3 out of 10. He also had improved skin condition and was able to perform tasks that he was not able to perform before. So in the end, the compression, complementary, and alternative medicine provided by occupational therapist Lauren Frame proved successful for her patient, Mr. C.